The only time a woman should be prevented from breastfeeding her child after giving birth, even if it's through cesarean section, is only if this woman is not clinically stable or the child is not feeling fine. In most other occasions, it is encouraged that the woman should start breastfeeding as early as possible, if possible within the labor room itself. This woman should be encouraged because early breastfeeding is important to both the woman and to the child. In some occasions sef, you have to encourage this woman to start breastfeeding if it's possible on the theatre table. But one of the conditions, one of the reasons why people don't do all these things because of logistics, maybe because of human resources. Apart from that, a woman that has given birth should be encouraged to start breastfeeding early enough. Why is breastfeeding important? Especially early breastfeeding. It's important to the woman, number one, because it will help the woman to have adequate uterine contraction. That moment the child is suckling on the breast of this woman, it helps to stimulate the brain to release a hormone that is called oxytocin. This oxytocin goes to the uterus of this woman and causes it to contract. And this contraction of the uterus helps to prevent bleeding. There are some women after giving birth, they'll be having inadequate uterine contraction, and that can predispose the woman to start having bleeding, early bleeding after giving birth. But if this woman has already started breastfeeding, the chances of this bleeding will be reduced because the suckling effect is going to cause the uterus of this one to contract. Apart from that, breastfeeding itself creates bonding. There is this kind of love that this woman is going to feel and this child is going to feel. That kind of relationship between the child and the mother is something that cannot be created by any other form. So it's important that this early bonding between the mother and the child starts as early as possible. So if you're a woman and you are pregnant and you have been told that you are going to give birth through cesarean section or by any other means, please request that you start early breastfeeding. That you request that you should request, talk to your nurses, talk to your doctors, please, can I start breastfeeding as early as possible? Because that early breastfeeding is important to the brain of that child. It helps the brain of that child to develop very well. Do you understand? Then apart from that, when you are carrying your child, it gives you this sense of encouragement that you have done a good job, and this will also help you to be healthier as time goes on in that your preparer period. So early breastfeeding is very important. The importance of early breastfeeding after the giving birth cannot be overemphasized. Kindly help to share the video to other people so that people will be able to understand what I just taught in this very video. Thank you so much.